Roots on TV, oats porridge, hard-dough bread, a sip of herb tea for breakfast. I remember to wipe my mouth at the bus stop on Roundhay Road, where I walked a short Grace Jones Afro style, black girl pride channeling my steps. I rode 2 buses to Bramley Town End just to get to school. At intake high, during class registration, the teacher asked, "Who watched Roots on TV?" And me, the only black child in class, screwed up my face, kissed my teeth at classroom laughter, cut my eye at Janet Whitehouse, sat next to me, scribbling NF on her desk. A white girl pride. At intake school, not one hard-dough bread eating kid in my class, just chips and beans, NF and British movement followers, propelled spits, taunts in Yorkshire, slurred names, chocolate drop, nignog, sambo, jungle bunny, gollywog, kunta kinte, kizzy, go home. Mum always said she should have gone back home when rivers of blood ran deep in the current of Enoch Powell's hate, the Tiber foaming with blood, an urgent encouragement of re-emigration. Send them back, load the ships with chocolate smiles and send them back before blacks take the whip hand. No blacks, no dogs, no Irish, 1 down and 1,000,000 to go. But unabanya, Mum said. I sweep the Union Jack under the bed.
My name's Sarah Erskine. I'm Head of Mental Health in the Public Health Directorate in Leeds City Council. So in effect, I head up a programme of work around reducing the risk of mental health problems, improving access, experience and equity, and influencing what happens in services, and also promoting good mental health.
My name's Sharon Prince. I'm a clinical and a forensic psychologist. I'm the Deputy Director for Psychological Professions at Leeds and York Partnership NHS Foundation Trust. I started on this journey with a passion of knowing about overrepresentation, and it all started when Sarah and I met. I met Sarah, then we met with Sinead, and we came together to think, what can we do about this? How can we make a difference? We recognised this was and this predated COVID, predated the Black Lives Matters and before George Floyd. So for some years we've been on this journey together to think about how can we make a difference in Leeds.
I am Sinead Cregan, Director of Development and Innovation at Inspire North, a large North of England charity, and we provide mental health accommodation, we provide supported accommodation, we work with perpetrators of domestic abuse, and we also provide a domestic abuse refuge, and we also work with younger people with dementia. So a real wide range of services. And we're also a housing association, so we have our own accommodation that we provide as well.
In Leeds, as with elsewhere in the country, people from some diverse communities are more likely to be detained under the Mental Health Act. And in Leeds, if you're from a Black population group, it's almost 3 times as likely as someone from a white population group. And if you're from an Asian background, it's around twice as likely. So that's the situation at the moment. And it was the situation when we started this work in 2017, when we tried to start to have conversations about how we address the overrepresentation of some diverse groups detained via the Mental Health Act. It was really, really challenging. It was very difficult because there was a lot of anger and distrust, and we didn't really have the language to talk about it. And it was at that point that a couple of people in Leeds had heard about the National Synergi Collaborative Centre, and we started to make connections with Joy and with Cam and with James. And it was through talking to them really that we understood that the confusion and the complexity and the conflict was actually part of the process.
Prior to taking up this role, I was employed, as I said, as a commissioner manager within the council. And I've been doing that role for quite a long time, which meant I knew a lot of people in the city. I also knew people regionally and nationally because of the role that I undertook at that time. And that put me in touch with a real variety of people that came into the city to look at our strategic work. And I was heavily involved in the development of the Leeds all-age mental health strategy. And part of that was looking at, obviously, the higher incidence of detentions using the Mental Health Act and BAME communities. And I got involved at the very early stages of the City Council engaging with Synergi.
Synergi's formulation of the problem, which is, service user voices, experts by experience, their voices have been silenced because it's too difficult. We don't have a shared language around this. People in bureaucratic systems and white people often move away from trying to address this difficult problem because it's too difficult and it's too challenging. And that was really, it felt revolutionary to have external partners say that this is part of it and this is the formulation of the problem, and therefore the solution might be the opposite to what that problem was.
And so we all, as a city, have made a commitment to try and do this together in a way that feels different, feels authentic, centres service user voices, and has those uncomfortable conversations.
The priorities for us from a public health perspective and from a Synergi-Leeds perspective are around developing action and supporting community action that reduces the risk of severe mental illness, that improves trust between communities and statutory services, and that builds what we call psychological capacity within communities. So understanding of how mental health systems work and really importantly, feed through from what communities are saying into mental health services. That's a really important priority for us. The second thing really is around continuing to grow and develop the Synergi-Leeds network, because this is a place where people can come together and feel supported around trying to address racism and discrimination as it manifests itself in services, but also maybe the results of racism and discrimination on mental health. Very early on in the process, we held a Creative Spaces event, and people told us from all walks of life and all parts of the system, people in education, people in community groups, that they felt very alone and they felt very isolated. So enabling people and supporting people to come together as part of that network, that community of practice, and for them to feel energized and supported to go back and make changes in whatever part of the system they work in.
We've had a number of Creative Spaces events which have been co-created with service users and have felt really powerful. We've engaged city leaders in thinking about how do we tackle ethnic inequalities, mental health inequalities together. It's about collaboration, it's about relationships and seeing people for who they are, and unless you engage in people's lives and stories, then why would you do things differently?
I'm Dr. Nuwan Dissanayake, and I'm a consultant psychiatrist, and I work with the Assertive Outreach team in Leeds, which is a team that supports people who have psychosis, who have struggled to engage with services or to be engaged by services, who have a history of lots of admissions to hospital. And I'm also the Associate Medical Director for mental health legislation in Leeds. People who are not involved in the application of the Mental Health Act see the problem as one of happening at the point of detention. And there is certainly bias at that point. So if you look back, we see For example, the case of Orville Blackwood and the review into his death in 1993. And that was subtitled Big, Black and Dangerous, and that was because there was a recognition of the bias in individuals and in institutions towards black men and their perceived risk. And I think people who are not involved in the application of the Mental Health Act see that primarily as the problem sometimes. There is no doubt that it plays a part, but I think we're starting at the wrong end. By the time we get to detention and there's somebody who is involved in that process, people are generally pretty unwell at that point. So what we do need to go back to is, where does it start? And what are the problems that lead to that? And this is harder for people to grasp because we then start to focus on structural and institutional racism as opposed to individuals. There have to be some changes, I think, to how services approach people from different backgrounds. So if we show in Leeds that we have far more people from minority ethnic backgrounds in the acute pathways, and we did some work about that. But we have less people here, I think, in the psychological therapies, for example, and accessing services in the first place. It has to start with kind of listening first to how things really are. And my profession is terrible at this, in my view. You know, I became involved in the work that I'm involved in because of that, because I had gone to explore what the world of psychiatry thought about this, and actually there was a denial of it, almost like climate change denial, with people saying it wasn't about ethnicity, it was about people's levels of social support and about risk and about genetics and about all sorts of different things, rather than ethnicity being a major thing. So that's a step forward, I guess, in terms of at least acknowledging that. But then how do we then turn that into something that means change on the ground?
I'm Jim Barwick. I'm the Chief Executive of the Leeds GP Confederation. The Confederation is a mechanism of bringing all those practices and those primary care networks together to improve the quality of general practice and how general practice fits with the rest of the health and care system within Leeds. Certainly what we're seeing in general practice is a significant increase in mental health problems. Whilst there are mechanisms to support people with mental health, the demand on those services remains very significant. We have a mental wellbeing service in Leeds, which is made up of the Mental Health Trust, general practice, the third sector, etc. And some of the things that we've observed through that service has been, for people from ethnically diverse communities, their recovery through mental health is slower than from other groups. So we've put more energy and focus into what makes that recovery slower and can it be improved. So that will be changing the techniques and approaches around mental health, particularly lower level mental health. One of the other things that we have done around mental health is put in community counsellors particularly from black communities that are specifically there to support people with mental health on the ground. They're known in the community.
My name's Heather Nelson. I'm the Chief Exec of Black Health Initiative and also a member of the NHS Race and Health Observatory. Black Health Initiative is a community engagement organisation, and we're here working to address inequalities and inequities that we find in education, health and social care. We focus very much on, predominantly but not exclusively, the black communities that we have here in Leeds. And we recently set up our mental ill health service. And it's very much about the black community because of the cultural taboos and issues that mental health has attached to it within those communities, for all sorts of different reasons, be it faith or family connections, you know. So what we had to do was actually start in a non-traditional, as in non-European way of actually addressing those issues. So our outreach is targeted and it's effective communication as well. So we will speak to people not necessarily just about mental health initially, but about their health. You know, how are they handling with the stresses, especially during the pandemic and with the visible murder of George Floyd. You know, we are traumatized repeatedly when we are seeing the negativity that's happening towards us. When you look at the stats that show the stop and search incidents, but not only the statistics, it's lived experience, because we work amongst these people. We understand, I am one of those people. So of course, it resonates more to us. Now, I've been working very closely with a few of the leaders in the various sectors about service provision and saying we're always talking about one size doesn't fit all, but unfortunately we're still using that one size. And to get rid of that one size, we cannot have the same people around the table all the time, because it's going to be a same thought pattern throughout. If you want effective change, then you need to go out and listen to people, be involved with those people, and actually have those with lived experience or those who are working within those communities sit around that table as well. How often do we find that those leaders understand us as people? And let's be very specific about Black people. There's never usually translation for Black people, yeah? However, as much as English may be our main language, I'm of Jamaican heritage, for me to, sometimes to express myself, I go back to where my foreparents and parents come from to explain that, but I know that doesn't necessarily work. I can give you a good example of that. A couple of years ago, we had one of our elders come to us and she says she thinks she's got sugar. So I said, okay, you need to go to the doctor. She went to her GP, said the same thing. He literally rang me while she was on consultation and said, why is this woman here when she's wanting sugar? And I'm like, no, what she's telling you, she thinks she's diabetic.
So I'm Khalid. I come from Northwest, and I moved to Leeds to study. Touchstone has been one of the main organisations I've been involved with for support throughout COVID, and there's been many ways they've supported me. For example, the actual ethos of the organisation is keeping the service user included in all aspects. For example, there's other stuff like lots of men's groups that I'm involved in, and these really contributed towards my mental health and well-being. Especially when you're living alone, isolated, is a whole different perspective. And having that kind of regular update with a group that you feel part of, it's like another family you've got, a surrogate family you've adopted, basically. That's how it felt like. And they keep saying, you know, there's not enough funding. It's just horrendous to hear. There's lots of funding. I've seen so many groups, in the majority groups, where they can facilitate so many other things. Why is it not happening for the minorities? Why not? You know, men being 3 times more likely to commit suicide. This should be highlighted, especially in Leeds, which has the highest suicidal rate for men. So, although I'm talking about minorities, there needs to be more done for men as well, because that's why we have these men's groups. That's why we have these safe spaces for men to come and discuss, because it is okay. Just because you are a man does not mean that you cannot share what's on your mind. The one thing that made the main difference for me in actively engaging with these services is the lack of judgment. For example, you come in, it doesn't matter where you're from, doesn't matter what language you speak, doesn't matter how educated you are or not, to be treated fairly as a human being. And we're all human beings, so we like to see that being put into action.
My name is Arfan Hanif. I'm the Chief Executive of Touchstone. Touchstone is a mental health and wellbeing charity and service provider, and it started off with 2 social workers in a terraced house 40 years ago to provide some community-based support, shifting the mental health intervention away from hospitals. And 40 years later, we are 250 staff. We serve around 10,000 service users across Yorkshire, of which a third of our service users come from black minority ethnic background. And in terms of our staffing, around 40% of our staff come from black minority ethnic backgrounds. And we provide over 3 dozen different mental health intervention services, right from the preventative side right up to working with people with severe needs in hospital. And that's what Touchstone is, but our heart very much remains in the community because that's the origins of Touchstone. So I'm still currently a service user. I recognise that I have a mental health condition. I have a bipolar condition which was diagnosed about a decade ago. However, my pathway into this diagnosis was quite traumatic. I was sectioned under the Mental Health Act about 10 years ago. And at the time, no one really told me what was going on, whether I was being assessed or not. I was shifting from one building to another building. Police were involved. And it felt like being a victim rather than someone who was being cared for. And whilst I was in hospital, one thing I did notice was the majority of people in the hospital setting, which were patients, were black minority ethnic people like me. And I know we're not the majority in society. And more significantly, the majority had been forcibly brought into the hospital by the police. And of the white patients, quite a few were voluntary, they were brought in. And in my own experience, 2 days before I got sectioned, I actually went into crisis into the hospital looking for support, and I was ignored. Yet 2 days later, they deemed it high risk and brought the police to my house and took me away. And during that night, it took me out of area of Leeds. So that was quite a traumatic experience. However, through that pathway, understanding the mental health system from a hospital setting and then shifting into the community-based mental health, and bit by bit I moved into Touchstone as a service user. I was in this very building 9 years ago, and that created a pathway to where I am today. It's through that experience that I became chief executive, not due to any professional background in health or social care or mental health. And the reason why I became chief executive is Touchstone can never lose sight of what it's about. It's about ensuring that the service user's voice is heard. We're also recognising that the voices of black minority ethnic groups is never lost.
Hi, my name's Ellie Rogers. I'm CEO at an organisation called Leeds Gypsy and Traveller Exchange. We are a community members organisation for gypsies and travellers based in Leeds, West Yorkshire, but we deliver our work across all of West Yorkshire. And we exist to address 4 main issues that the community face, which are accommodation, health, education and social inclusion. Gypsy and traveller communities face some really severe inequalities when it comes to mental health. I started working at Leeds Gate 7 years ago, and that was really apparent to me as soon as I kind of came through the door. Just the amount of suffering that there was in the community around mental health and how little support people had access to. Really, for our members, this has just meant a persistent experience of being left out, I would say. And I think it's been our ambition to try and raise awareness of the issues that gypsies and travellers are facing and make sure that they are represented in, things like health needs assessments, mental health needs assessments, strategy, policy, because really it starts there and it trickles down, doesn't it? So if you're not seen at that level, then you're not going to be seen in sort of accessing services. We did do a piece of work when the mental health community services were being recommissioned in Leeds about how many gypsies and travellers were accessing that service. and at the time it was zero. Zero people registered from a Gypsy and Traveller ethnicity. So yeah, we've worked really hard with our partners in the statutory service to try and address that. Now we have a mental health support worker funded and based at Leedsgate, which is brilliant. And I think a lot of this work has been really strengthened by our relationship to Synergi.
My name's Pip Goff. I work for Forum Central, which is a network of third sector, voluntary, community and faith organisations working around health and wellbeing in Leeds. We've got about 250, 260 member organisations who are all really passionate about improving the health and wellbeing of communities. In terms of Black Lives Matter and the response to that kind of very strong need to act and be proactive, I think that really kind of got people from third sector organisations to really think quite differently, that they needed to do something about the racism and the challenge that we knew was there in the system that we talked about for so many years, but that actually we just needed to really do things very differently, that talking about it and knowing it was there wasn't enough. So I think bringing that in sharp relief, I think, was very helpful, and certainly as a network of third sector organisations, we started meeting together to have particular conversations in response to the Black Lives Matter agenda and that challenge to do something very practical and tangible that got us asking Black and other minoritised kind of workers from third sector organisations to talk about their experience and their solutions, to think about reporting of kind of racism and hate crime, to think about data and how differently we could start capturing the actual reality of the situation. But we're particularly proud that we're now working with public health and other partners to have the post that's focused on children and young people and health inequalities in mental health.
My name is Marvina Newton. I am the Mental Health Inequality Lead for Children and Young People for Forum Central. But I actually stepped into this role from some of the work I've done as the founder of Black Lives Matter Leeds, where we did a project on Being Black and Being Me, which was looking at children and young people's mindsets and the impact of racism or institutional racism on their mental health and well-being. Before you invite someone to your house, you're going to ask them their dietary requirements. You're going to make sure you cater to their dietary needs. What happens is that I'm not going to invite you to my house and then feed you whatever I have at home and expect you to take it. That's what happens with our healthcare system. We are creating systems without speaking, and I mean not the tokenized gauging of stats, really going to the grassroots of young people and children and saying, what do you need? Let me get your voice and your influence. Let's build this system together. System leaders, I need you to become better allies. That's the message I want to actually go across to everyone listening to this. The first thing is that to be an ally, you need to act. Act on the inequalities that you see. If you know a system is not catering and you can see that the diversity is not in your workforce, in your training, make sure you do something. You need to listen to the communities that are being affected. Listen to the communities that are not being incorporated in your system. That means you have to make sure it's active listening, not you trying to respond in a defensive way.
I'm Delvina Saunders, and I am the Mental Health Ethnic Inequalities Lead for adults, and that post is hosted within Public Health Leeds, with Leeds City Council as well. And the role is very vast, but it is supposed to concentrate on the overrepresentation of Black and other minority ethnic people being detained under the Mental Health Act. And we're looking at priority 2 in particular of the strategy to see how we can try and reduce some of those mental health inequalities for people. The grants process has been a firm favourite of mine during my position, just simply because I've been able to witness very small grassroots organisations flourish, having never had any previous funding before, but now having the opportunity to use that funding to make further impact than they already were. The name of the grant was Addressing Mental Health in Ethnic Minority Communities, and when I've spoken to some of the grant holders that were inquiring previously before, numerous of them had these fantastic ideas of how to run a programme, how to run a programme that's going to reduce mental health inequalities within children, within families, within adults, and they were the 3 different areas that we were focusing on, and we wanted to make sure that all 3 of them got the same kind of equal attention. Another really important part of my role is being a part of the Synergi-Leeds creative spaces, and that is a space for us to be able to create something where we can showcase some of the work that has been done surrounding mental health inequalities, an opportunity for us to really get a better understanding from statutory services and also the third sector about what changes they're making within their organisation to be able to address this agenda.
My name's Lutel James. I'm the CEO of Chaptertown Youth Development Centre, which is predominantly a young people's organisation, working with young people from 4 years old right the way up to 25 with multiple activities. We've been around for 20 years now. We started in maybe 2001 officially, and then we've worked right the way through till now and sustained the organisation. There's over 1,000 plus young people on a weekly basis engaging in positive activities. The activities range from gang prevention programmes, employability, mentoring and coaching, boxing, rugby, educational support, and a wide range of programmes to engage with young people in a meaningful way. The funding that we received as an organisation was massive, and it was based around the stigma of young people and black people, blasé, parents and all of us around mental health. It's not something they can talk about, it's not something that they want to acknowledge. It's something that's seen as, well, if I admit that it's weak or I'm mad or I've gone off the rack and I'm not compass mentis, and it's sometimes create family embarrassment. If every child from the early ages right the way through to adulthood, if we don't understand working with young people that every stage of their mind matters, so their design, their understanding, their feeling, their emotions, their anxieties, their challenges, if we don't go through a process with them and every element of their mind matters through all them stages, then we're going to lose them somewhere because we're not considerate about how you feel about that. It's okay saying we're putting on this, this and this, that's great, but then if you don't look at each area of that delivery and see how it affects that young person in a meaningful way, good, bad or indifferent, and you're not assessing that, then what you're doing is just going through a process and dragging them through it. We've got one key worker that kind of manages that area of work, and that key worker will have engagement with parents, so they'll facilitate, the key worker will facilitate parents' meetings to talk about how important it is to even talk about mental health to your young people. But equally, how important it is for you as parents to understand that you've got a part to play in this as well. So the key worker will facilitate and get support of, say, another 6 or 7 volunteers to facilitate workshops. Then workshops will be in depth. It'll explore how you feel about mental health, how it's seen within your community, how it's seen within your home. Is there any experiences of mental health and how did you feel about it? You then do the workshops throughout over many young people, but then you start highlighting a much more in-depth need where there needs to be one-to-one sessions. If we haven't got the capacity to see it to where it needs to go to, then we've got to refer and to support onto specific agencies that specialise in that, and that's all they do. Because what we don't want to do is be detrimental to young people, saying we can achieve everything. We'll do our bit, which might just be engagement, understanding and connectivity. And if you can do that and connect many young people to services that they might not ever have accessed, then that's a winner in itself.
I think the next step for us has to be talking with system leaders about the leadership and management of this. And when I say systems leaders, I also feel a bit uncomfortable because it's not just about systems leaders, it's also about those who represent the service user and carer voice in this, about how do we sustain this? And we had some really generous funding from CCG for this project, but there is something about anchoring this work somewhere within the city, and I'm not even sure I'm necessarily saying anchoring it in a statutory body or the voluntary care sector, but where does it fit so it can thrive and stay true to its values and principles, because what you don't want it to become potentially is another kind of work stream or project that goes how work stream and projects go in the statutory sector.